Honourable guests, ladies and gentlemen, my name is Frank, and thank you for that kind introduction. It is a delight going around the planet, and I think the only thing I'd add to that is I'm very pleased, relieved and proud to say we've actually just gone live in Malaysia with one of the KPJ hospitals. So it's a delight to be actually working here. Today I want to talk about national EMRs. So that's National Electronic Medical Records. Sometimes you hear that referred to as one patient, one record. And they're basically the same thing. We just want the patient's data available right across the country. Here in Malaysia, there's an app that does some of that, My Sejahtera, for the vaccines, and you've got the demographics. And then we were talking about privacy and safety and security. Well, you know, there's one that's working right now. You know, when you're busy and you've got to do something during COVID, I think that's a pretty good result from the Minister of Health. Well done. Underpinning national EMRs, obviously it's all about IT. I learned about IT at school when I was 14. I learned how to write computer programs. I'm actually quite old, so back then the school didn't have a computer. We used to write it on pieces of paper, and the teacher would pretend to be the computer, and he would write down what the computer would have done if the school had had a computer. So strangely, I thought this was very enjoyable. And then when I was about, 14 and 3 months, we got a pass to go to the university. And I was actually delighted to meet a real computer. It was very exciting. And then I spent most of my weekends going into the university and after school. And and during the holidays. And I really enjoyed computer programming. I wasn't sure what it was for, but a year or so later, my mum and dad ran a small business. They were quite busy. They employed about 15, 20 people. They worked about 8 or 9 hour days. And they were just quite busy with the administration. And I wrote a computer program that calculated their VAT, income tax, did their payroll, various things. And within 2 years, they were employing 60 people. I nearly went forward off the thing there. Within 2 years, they were employing 60 people and then up to 200 people. They became millionaires. They got their life back. Mum and dad had a day off per week instead of working so hard. They started actually going out for dinner together. They'd never done that before in their lives. So I think they might even have some romance back in their marriage. But I don't know. They never told me. But what I did, you know, at a very young age, I saw the power of IT to transform things. I then went to work for a bank. It was the largest retail bank in the UK. And again, PCs were very at their infancy at that point. And obviously there were no smartphones. But again, we saw very quickly the power of computing to transform the customer experience. It helped the bank become more profitable because that's what the bank was about. The staff felt more relaxed. They made less mistakes when they were using the computer rather than paper, which is in fact the thing that freed my mum and dad up. They didn't have to keep rechecking it because they just did it once. The computer made sure it was right. They didn't have to recheck their sums. And at the bank, it was a better experience for the customers. For the past 25 years, I've been working in healthcare and IT. And a fantastic example, again, of IT helping. I saw a team of community nurses. So they travel around, visiting elderly or young babies or any kind of general sickness, tending to people in the community. And by simply allowing the computer to plan their days, working out which patients need to be seen first, what was the best route between each house. They went from having a sizable waiting list of waiting for weeks, patients waiting for weeks to be cared, to within 2 weeks, a waiting list of 0. And they got 30% of their time back. So they had 30% of time free. Now, considering that for clinicians, doctors and nurses, time is the most valuable thing we can talk about. There is no country in the world that has too many doctors or too many nurses. There's a shortage of healthcare, and it's growing and growing with our aging populations. So, that's stunning. I'll say it again. 30% of their time became free. And then they could dedicate that more to patients. Right now, back in the UK, sorry, I'm from the UK, but you probably guessed that. For our GPs, we're about to start automatically filing pathology results. So GPs spend about 30 minutes per day working out whether or not a pathology result is normal or not, or it's normal for this patient, or it's going up, or it's going down. Is it dangerous? We're now going to start automatically filing them. That's going to, just the normal ones, not the abnormal ones, but it's going to save the GP right across the NHS in the country where I am, 30 minutes a day. That's a tremendous saving and can only be done by computers. And I want to give more examples of how computers help. Oh, there's one more, yeah. So in hospitals, we've already seen that by having a joined-up EMR, because when you're doing a pre-op, before an operation, you need to do a pre-op assessment. So you need to collect loads of data about the patient and make sure that they're fit for this operation. Pretty much all of that data will be there in primary care, in the clinics already, or with the private GPs. At the moment in the hospital in the UK, on average, it takes over 45 minutes to do each one of these. If you've already got the primary care record, if you've got the EMR flowing in, we're down to 5 minutes. So these are just examples of time saving. And I think everybody understands what saving time means. And we turn to national EMRs. So back in the day when I was young, well, when I eventually saw my first computers, computers were about as powerful enough to run maybe a clinic in healthcare. Maybe 3 or 4 doctors, 3 or 4 nurses, and the computer will be really breaking a sweat to make that happen. But a lot of time has gone by since then. And I think many of us don't realize actually how smart our computers are, how smart our smartphones are. You may know, or, well, most of the geeks in the room, including me, will know, there's more power in your smartphone than there was available to Neil Armstrong when he was putting the lunar lander on the moon at the end of the 60s. There's very probably more power on your smartphone right now than the whole of NASA had at that time. And the ability for computers to process and crunch numbers, we've moved away from, a single clinic. And now we have the power on one computer to run a national EMR, serving millions and millions of patient records. Systems that can run in every situation, in clinics, in hospitals, in prisons, in ED departments. They're powerful enough to do it. You don't have to, but I want to tell you the advantages of doing it. But I want to start off by saying, what if you don't do it? Because most people don't have a national EMR or anything close to it. And this is the situation for most countries at the moment. And I'm going to give you some personal examples, just from my family, but the presumption here is that you will have had similar examples. And people across all the ASEAN nations will have had these similar examples. About 26 years ago, my dad was coming to the end of his life. He had a terminal illness, and he had a do not resuscitate order, a DNR. So he had his last heart attack, and he was rushed to the emergency department where they didn't have access to his medical record. So they zapped him back to life and put him on a ventilator, which at the time I thought was wonderful. I thought it was fantastic because I thought, oh, Dad's coming back home. But slowly over the days, we realized that my dad was never getting off the ventilator, and we were going to have to switch him off. And that was a terrible decision for my mother and my brothers and my sister. Much later, my mum, she broke her hip, and very common, very frail, very elderly, and went into hospital. And after the operation, she was sort of recovering with the hip, but she wasn't eating. And after, I think, about 10 days, the hospital was ready to put her on end-of-life care because it looked like that was it for Mum. And finally, it was my sister, we managed to sit down with the doctor, and my sister just said, I just want to check that we're doing absolutely everything we can. And she went through the drugs that my mother took in primary care. And at this point, the doctor realized that my mum was suffering from something called Parkinsonian syndrome. It had to be explained to me when mum first got it. So when you're walking, it's sort of a reflex reaction. You sort of put one leg forward. My mum couldn't put the first leg forward, but if you sort of give her a bit of a push and got that first leg moving, she could walk quite naturally. And that was just one example of the getting the muscles moving. And what she was suffering from in the hospital was when the food got to the back of her tongue, there's quite a few complex movements that involve swallowing the food. And without these pills, she just couldn't eat. So the doctor gave her the pills, she started eating again and came back, and she was quite healthy. And the other personal example is my sister managed to get her appendix taken out 3 times. And just to make sure you've heard that, 3 times at our local hospital, by the same hospital, 3 times. And I spoke to one of the surgeons and I said, but she's had it taken out before. Didn't you look at her notes? You know, I was a little bit frustrated. And the surgeon said, he goes, I'm sorry, Frank. He said, it takes a day. If I request the notes, it takes a day for those paper notes to land with me. Your sister was in great pain. The symptoms looked like appendicitis, so we went in to take it out and realized that it had already been taken out. So all those examples, whilst they sound terrible, and I'm saying you will have examples like that, and there'll be examples all over ASEAN of things like that. The doctors bringing my dad back to life incorrectly. The doctors in the hospital failing to put my mother on the right drugs when she arrived in hospital. They basically lost what we call her on-admission drugs. And my sister having her appendix taken out 3 times. In none of those cases do I believe that the doctors or the nurses were at fault. They were acting on the information that was in front of them. If you have bad information, you're going to make bad decisions. They didn't have an EMR at their fingertips. There was no way for the hospital at that time to know what was going on in the clinic. And that's why I think these problems will be very common now. So I'm going to give you some, I've been working on this for 25 years, and I've had some fantastic and moving experiences of what happens when you do have a joined up EMR. And I'm going to start with some very simple ones. About 24 years ago, there was a young girl in the north of England where I live. She's about 21, and she decided to commit suicide. She ate all the pills, and the container for the pills, she cleverly flushed down the toilet so nobody would know what the pills were. Her friend found her collapsed on the bathroom floor, and she was rushed into the ED department. Now, normally what would happen then, sorry, it was the middle of the night, I forgot to say that bit. Normally what would happen then is the ED consultant would contact the GP. The GP, obviously, or the clinic, they wouldn't be at work at that point. So they'd have to come in, drive into the practice, taking probably about half an hour. And then there's a verified phone call back to the ED department, making sure that they know who they are. And at that moment, then they can reveal and read out what's on the patient record. Because there was a joined up EMR between the ED department and the clinics and the GPs, in this case, the consultant was immediately able to see what pills this young lady had access to, was immediately able to say, I know it's those pills. Those pills are the ones she's taken, and gave her the right treatment. And what he said was the joined up EMR saved this girl's life. That was his words, you know. An example, a slightly softer example, but I think just as important. About 23 years ago, there was an elderly lady, and she was coming to the end of her life, you know, with, you know, the point where you've got hours to live, and she came into ED. The consultant, because it was a joined-up EMR, completely different part of the country, it was in the west of the country, sorry, the east of the country, was immediately be able to contact her son and her daughter, who came into the hospital. The mum died about an hour after arriving in, but her son and daughter were there with her when she died. And if there's any moment in life that you desire, because we all want our parents to die before us, and to be with your parent when they're dying is perhaps one of the most important and dignified parts of life that we could possibly hope for. And again, the consultant said it was the power of the EMR to do it. A few years ago, we had a dreadful tragedy in London. A tower block caught fire, killing 72 of the people who lived there. It was called the Grenfell Tower. You may have heard about it. It did hit international news. It just so happened that my company were involved in this because we looked after the GPs around the area, and we got contacted by the coroner's officers to see how quickly we could get the information about who was living in the tower to them. And the problem that they had very incomplete records of who actually lived there because people weren't so careful. But the medical records of the people going to the doctors described their addresses perfectly and said exactly who they were. So we were immediately able to get the data to the police, to the coroner's office, and immediately the sense of relief from the police, they said, now we know who those 5 bodies are. Just because of their address. They were able to do different things, identify things by some of the operations or some of the things that was happening with those people who have been so tragically killed. If any of you have ever had to wait for a coroner's report, which can sometimes take weeks, when you're waiting for closure on your loved one, it's the most horrible, difficult moment. And it was so important to do that quickly because people weren't sure if their loved ones were in there. People would be hoping, maybe my sister or my brother went out to the newsagent, maybe they went out to the fish and chip shop and they didn't die. And so you'd always be wondering that and never be sure. So closure on death. And now, this one's particularly moving for me because now, right now, that is now happening all across England. So we're going to be, all coroners are now going to have access to deceased patients' records, where appropriate, of course. That's going to make it much easier for grieving families, and they're going to get their information faster. I've deliberately picked out some unusual examples because, well, it's because of my experience. But I want you to understand how important that EMR can be just for everybody's life on an everyday basis. If we have a national EMR, we have big data, and I think pretty much everybody in the room knows what comes right after big data. It's AI. And it is fabulous what AI can do today. I think when I first experienced this, we built a predictor for ovarian cancer that could predict ovarian cancer, the need for an ovarian cancer test more quickly and more reliably than a doctor. It was quite a moving moment. A stunning moment because you realise the future is here. So what's AI going to be able to do for us? Well, it is doing now. It's diagnosing cancers. It's going to predict for us who's going to become diabetic. And it's going to predict for us those diabetics who are moving away from their safe zone. And given that one of the biggest problems facing all the developed nations is NCDs, non-communicable diseases, and of those, diabetes is a highly significant one. The cost for the human, the cost for the individual, the cost for the health service, of course if it gets worse and you have to be moved into hospital, or kidney failure is now becoming endemic. If we can tackle that, and AI will help us do that, we can move to, instead of an endocrinologist looking after maybe 200 patients, with AI we can amplify that voice. We can have an endocrinologist looking after tens of millions of patients with AI. All we need to do is stratify the risk. Over the next few years, I will be using my smartphone and you'll be using it. You will get a probable diagnosis on your smartphone before you've arrived at your clinic or your GP or your ED. That is going to happen, and I've personally worked on that. And it's a fantastic thing to be able to see that happening. It's such a time saver for doctors and nurses. Instead of sitting down with the doctor and nurse and answering all the questions in front of them, you can have it pre-answered before you arrive. Your smartphone can then say to you, go back home, or look, you need to go to the pharmacist, not the doctor. Or actually, you need to go to the ED department right now, because it's so urgent. This is what's coming. This will be the democratization of healthcare for, instead of those who live in our most expensive cities near the expensive hospitals, the people in our rural areas will have more access to the best healthcare, and everybody will have access to that, no matter how rich your nation is or how rich the actual person is. My penultimate topic is COVID-19. You can't really stand on this platform after such an international pandemic as COVID-19 and about the relevance to EMR. And naturally, I hope you're all thinking, yeah, we need outbreak detection. And I want you to just think about this for a moment, yeah? All the countries were doing outbreak detection anyway. I know the UK was, and we were looking for outbreaks of measles and mumps and rubella and various other symptoms. The one thing we weren't looking for was an outbreak of what we now call COVID-19. Nobody was looking for the symptom of not being able to taste or not being able to smell. We completely missed it in the UK. It wasn't even coded. It wasn't even interesting enough to be coded. It was hidden in the doctor's notes. So I think what we'll be very good at if we do outbreak detection right now with the things that we have right now is if COVID-19 happens again, we'll be able to spot that. If SARS happens again, we'll be able to spot that. Or if Spanish flu happens again, we'll be able to spot that. But unfortunately, I don't believe, and I don't think any of you believe, that the next outbreak is going to have the same symptoms as the previous outbreak. National EMRs, a true national EMR will solve this. It's fairly straightforward to just measure every item. Oh my goodness, we're prescribing more penicillin in this village or in this state than before. Oh my goodness, there are more fevers happening here. There's more sore throats. People are getting itchy heads. Whatever the thing is. I was in Rwanda, a Commonwealth summit. There was a lot of health ministers there from all the summits, and I was on a panel, and a pharmacist said it, and I thought it was very profound. He said you could spot an awful lot of the next pandemic just by looking at stock control for your pharma drugs. And I think he was right. But with the EMR, we're going to spot lack of taste and smell. We will spot it. Because even if our doctors don't code it, And even if there isn't an ICD-10 code or whatever, or a SNOMED code for whatever it is, we can let the AI run on the notes and we can spot the trends in the notes. And I've been talking to quite a few ASEAN nations over the past months, and I think there's a great desire here and obviously in the UK for this not to happen again. The cost to life was horrific, and the cost to our economies, which results in a lower standard of living and actually results in more deaths, was also horrendous as well. Finally, there'll possibly be some finance ministers or hospital accountants in this room who will say, well, look, that's all very well, Frank, you know, but it's going to cost money. And it will cost money, but not as much as you think. I read a study a few years ago for the UK, my own country, that the benefit from a digital health economy ran into the many billions per year through drug trials, lack of mistakes, medical insurance, the research that's possible. And one might say here in Malaysia, let's just say it's worth £1 billion a year, or about $1 billion. Who cares? That's a very conservative estimate. Now, you can put an EMR in across Malaysia for about much less than £100 million a year, yeah? So for the accountants will have already got there, haven't you? So that's a profit of £900 million per year. So this stuff doesn't need to cost you money. Of course, it will cost you money if you keep wanting to pay more for your IT. I think some companies, especially some of the American companies, have done a fabulous job on you. They've mesmerized you with hypnotism and things. It's been the only industry where IT costs have gone up over the past 10 years. Instead of coming down, they've gone up, and people are paying millions and millions just for a hospital system. It beggars belief. I think we should stop drinking the poison water, snap out of the hypnotic trance, and recognize the scam that's being played on us. This is certainly the one time in your lives where more expensive does not mean better, by any means. I'm going to finish with this. That's my mother on the right there. She was the lady whose life I changed, and IT changed her and made her a millionaire. But she was also the lady who nearly died. And at that moment of her nearly dying, she's the most important thing in my life. This stuff is personal. It's personal for you all. And it's important enough to do just for that, even without the money that you're going to generate. And actually, her sister, that's my granddad at the back and my granny in the middle, my Auntie Teresa, my Auntie Kathleen, my Auntie Nancy, who's taken the photograph there. I think that's back in 1949 or something. She unfortunately died of ovarian cancer about a year before our company discovered the predictor for it. So it was very poignant, and it's something that means a lot to me. Anyway, that's my daughter on the right. I don't want her to die of ovarian cancer. I don't want my son to die of prostate cancer. It's unnecessary. And I think everybody in the room will feel the same way about their sons, daughters, mothers, fathers, and cousins. I think the national EMR is for everybody. I know some of the countries here have already started doing it, and well done. And I'm looking forward to coming back here next year and seeing and sharing how well we're all doing together. Thank you very much.